Hi everybody, Michelle Lyons with you here, and I want to talk to you today about how breast cancer and breast cancer treatment really affects more than just the breasts. Literally, when we're talking about breast cancer treatment, we need to think about every aspect of a woman's health, literally from head to toe, and everything in between. So digestive health, bone health, back health, everything. Nothing happens in isolation in the body generally, but especially so when we're talking about breast cancer. Surgery is obviously the mainstay of breast cancer treatment, but particularly if we're talking about treatment options like chemotherapy, radiotherapy, hormonal therapy, immunotherapy, all of these are going to have wide-reaching effects. So what I would like to invite you to do is just to join me, and we're going to take a little guided tour through the body and talk about the different effects, literally from top to toe, that breast cancer treatment can have, and of course what we're going to do about it, most importantly, right? So if we start at the very top, most concerns that women will have about chemotherapy particularly can often include hair loss and the cosmetic appearance. And that can be really psychologically very challenging. We do see a higher incidence of anxiety and depression for all the implications of a breast cancer diagnosis and then the stressful journey through breast cancer treatment. But I think we have to also talk about brain health during cancer treatment. So chemo brain is what it's known as generally, chemo-related cognitive dysfunction, to give it its full title. And this can be anything from foggy thinking, from word finding difficulties, short-term memory issues, to really quite distressing and stressful events, just that lack of ability to cope with your life as it's unfolding. The good news is that this is really responsive to a structured exercise program. So what we want to do is to make sure that we're hitting all those lifestyle markers that fall within our remit as rehab coaches. Nutrition, sleep, vital for good brain health, as we know, but exercise, generally a strategy that is going to be brain healthy, will be bone healthy and heart healthy, and also helpful in not only dealing with the side effects of breast cancer treatment, but also hopefully helping to limit the rate of recurrence of cancer as well. If we move down the body, now obviously surgery is generally almost universally used in the treatment of breast cancer. So we have to think about the implications of the individual surgeries, whether it's a full mastectomy, whether it is a lumpectomy or breast conserving surgery. We want to be able to help women with scar management, and particularly if there's been reconstruction using autologous tissues, using our own tissues. For example, if there's been an abdominal tissue reconstruction, very often what we'll see is a large scar going from hip to hip across here. And that's going to have implications, of course, for digestive function, for breathing, which is going to have implications for pelvic health as well. So making sure that we've got good manual therapy and exercise prescription skills for scar rehab, really, really important. Shoulder dysfunction is going to be affected, obviously, very obviously as well. It's the most common issue that we think of after breast cancer treatment. So working on strategies that are going to optimize mobility and strength are vital, but being aware that if somebody is on hormone treatment, so tamoxifen aromatase inhibitors, tendons love estrogen and tendons hate change. So both of those issues can be drivers for further tendon issues, tendinopathy issues throughout the body, in the shoulders, but also in the hips, and even issues with the plantar fascia with some of the hormonal therapies. Again, all very responsive to bespoke exercise prescription. What we don't want is for the side effects of these hormonal therapies to limit the time that women spend on them. So generally there's a recommendation that women stay on these treatments for at least 5 years and sometimes for 10 years. But there's often quite a high dropout rate because of struggles with the side effects of these treatment. Whether it's hot flashes or joint or muscle aches, we have something for that. We have a tool for that. So in the course we talk about, for example, CBT for hot flashes, and the exercise section of the Breast Cancer Rehab Coach course, of course, is full. I've got exercise contributions from learned colleagues like Jenny Burrell, providing mobility and strength training. I have Pilates content from Alwyn Thornton, and Laura Feeney has provided some excellent yoga content as well. So moving down the body, we've got to talk about heart health. Heart health is a major concern for breast cancer survivors. We know the heart loves estrogen. Estrogen is very cardioprotective. So if we're losing the cardioprotective effects of estrogen, we need to be on the lookout. We know that the signs and symptoms of a woman in cardiac distress are different from that in a man. But we do know as well that there's a possibility of some radiation scatter as well. If somebody's had radiotherapy for their breast cancer treatment, and almost every woman who's had a lumpectomy or breast conserving surgery will have radiotherapy as well. So we really need to be proactive when it comes to heart health in women who've gone through breast cancer treatment. Chemotherapy protocols can be quite cardiotoxic as well. Again, lifestyle approaches, nutrition, sleep, exercise, stress management. We keep coming back to those bedrocks of good health throughout the breast cancer course, because they can be tailored for each individual scenario, whether we're talking about dealing with the side effects of surgery, of radiotherapy, of chemotherapy, of hormonal therapy. But it's about having that toolbox that you can draw from to create a tailored program from the woman in front of you. Digestive health can be compromised, again, surgery, chemotherapy, hormonal therapy, inactivity. But weight gain is an issue that many women face after breast cancer treatment. And unfortunately, that has the potential to be a trigger for recurrence, particularly if it's central weight gain. So dealing with stressors, particularly really important for central weight gain management, as well as keeping an eye on insulin resistance. Going for a healthy, whole food, primarily plant-based diet really seems to have the most evidence behind it. Pelvic health concerns, an often overlooked issue with women recovering from breast cancer treatment. There's lots in the literature about sexual health after breast cancer treatment, but not as much as I would like in terms of bladder and bowel health after breast cancer treatment. So that is something that I do talk about quite a bit. We talk about back pain, recognizing maybe some different signs. Is it back pain due to breast cancer treatment? Maybe due to some inactivity and stress and lack of sleep, which we know are all big drivers for back pain. But also recognizing the signs that the cancer may have recurred and may have metastasized to the bones. So being aware of those different signs and symptoms. Coming down to the hips, hip strength really important. Obviously, we know even outside of breast cancer that 1 in 4 women in their 50s develop gluteal tendinopathies. Again, estrogen may be the culprit here, but we want to really look at specific exercise strategies for optimizing pain-free, fully functional, that ability to get out and enjoy your life during and after cancer treatment. And exercise really does seem to be the magic bullet for all of these side effects that we're talking about, but different exercises at different stages are going to be appropriate for the woman in front of you. Knee pain, again, joint and muscle issues because of hormonal therapy, because of inactivity, because of loss of muscle tone, whether it's chemotherapy or hormonal therapy being the driver here. And then coming down to the feet, plantar fasciitis, we do see that quite a bit with women who've gone through hormonal therapy treatment, who are going through it. So what can we do to help them get out of pain, get back to exercise, optimizing bone health, heart health, metabolic health, brain health, and just feeling good in themselves. Lymphatic health is something that we haven't talked about, but if somebody's had surgery or radiotherapy for breast cancer as part of their breast cancer treatment, then there is a lifelong risk of lymphedema. Knowing the signs that your lymphatic system is becoming stressed is really important. Knowing what to do about it in terms of self-care and self-management, breath work, self-manual therapy and exercise prescription are really key when it comes to optimizing lymphatic health. But the other things that are really important as well are weight management and avoiding constipation. There's so much that we can do to help women live well during and after breast cancer treatment. If you'd like to widen and deepen your toolbox, I hope you'll come and join me on the Breast Cancer Rehab Coach course. Thanks for watching, and if you've got any questions, please leave them below. Bye for now.